Great. All right, so let us begin this evening. First of all, welcome. My name is Daniel Fellman. I'm the current chair of the Human Rights Commission, and it is a pleasure to be able to meet with all of you. This has been an extraordinary year in a lot of ways, and the Commission wants to be able to help as much as we can. And so while we have done certain outreach during the virus, and we know there is much more that we can do, and so we decided to hold a hearing to hear from the community, to ask what can we do, what issues are going on, what are you hearing? We've heard conversations about the need for more Wi-Fi or internet hookups in poorer neighborhoods, for example. We've heard about how to get the computer hardware available so that kids can learn remotely, for example. I don't want to start planting ideas. What I really want to do is hear from you guys, from the community, what it is that is needed and what we can do. The goal here is not to bash what's been done, or for that matter, to praise what's been done. All of us are thankful for all of the efforts. And what we really want to do is look forward on this and see what can we do now going forward to help, because clearly the pandemic hasn't ended yet. And we want to do everything we can to help as many as we can. So with that said, what I'd like to do is just, if you have questions or comments, go ahead and raise your hand. If you can raise your hand electronically, great. If you want to raise your hand the old-fashioned way physically, that's fine too. And I'll do my best to go around. Let me introduce a few people here who are part of the Human Rights Commission. Dave Pazinski is a member of the Human Rights Commission. Sanjay Chablani is as well. Leonardo Sanchez is the immediate past chair of the commission. Rosalie Young is a member of the commission. John Rushing is a member of the commission. Suzette Melendez is a member of the commission. And Tricia Wachowski is a member of the commission. So please, questions, comments, the floor is open. We are recording this so that we have a record of it. And if there are specific things that we can respond to, we'll ask to get contact information from you directly so that we can respond and return to you with an answer and hopefully a plan moving forward to make things better for everyone. So with all of that, welcome. We're glad you're here. Who would like to have the first word?
They'll have to raise their hands because I muted everyone. Tell them that they've got to do the raise their hand thing.
Right, so you'll have to raise your hand either physically or electronically, either way.
Chat box if they want to join as well.
Right. Nobody has any questions or concerns or suggestions?
Leo.
Leo, please. Leo, you'll need to unmute yourself.
Good evening, everyone. I just wanted to say, as a clinician, I'm a nurse, and working with the community that has compromised immune systems and with the elderly, with the upsweep in numbers with COVID in the last, say, 10 days, a lot of seniors are finding it, they're scared to go out to get groceries and things like that, and they would seem to need something called helping hands, maybe some volunteers to help them in the community to buy bread, milk, water, toilet paper, any kind of, necessities. And a lot of people are finding it difficult because there's a friend of mine, Keenan Lewis, who is worked at ACR Health as a care manager supervisor. He showed me a picture the day before yesterday of the people at the health center going to get COVID testing. The line went around the corner through EOC, all the way around. There was almost an hour of people sitting in their cars waiting to be tested because people are trying to be proactive. As a community, what can we do to help the seniors that are scared to go out and get groceries because they don't want to catch COVID. That's all. What can we do to help the community post more sites for testing and help the seniors that are scared to go out of their house to get groceries?
Thank you. I received, I want to read for you, I received a piece of written testimony from Dennis Kaufman at Legal Services. He wrote in and says, "My name is Dennis Kaufman and I am the Executive Director of Legal Services of Central New York. Thank you for the opportunity to tell you about the problems our clients have encountered during the pandemic period." And he talks about what his people need. People in need of our help contact us by phone. During the pandemic period, people are experiencing legal issues much the same as pre-pandemic and those listed above, but concentrated in several significant areas. The total numbers of cases we completed and still have open is about 75 to 80% of what we did last year. We have completed almost 3,000 cases during the pandemic period and have about 1,000 open at any time. Housing-related issues are up about 40% of the demand for service both before and during the pandemic. We have seen significant increase in unemployment insurance, employee rights, and income stability issues, not surprising. Housing matters, especially attempted evictions, are critical needs. A recent study from the University of Pennsylvania highlighted the impact, and he goes forward. So evictions for him clearly is an issue. The second piece he mentions is our clients have experienced difficulty getting law enforcement to arrest, charge, or even acknowledge the actions were a crime. What he's talking about here is unscrupulous landlords have engaged in unlawful evictions without going to court. Our clients report landlords are shutting off water and utilities, changing locks, removing doors, threatening harm to get families to leave their homes. This is in spite of such actions being a crime in New York. One client reported that a law enforcement officer responded to a call by saying these actions by the landlord were justified because the courts were closed due to eviction proceedings. Another officer told a client that their department did not enforce criminal statutes unless the crime was in the New York State penal law rather than New York State real property law. And on he goes. So what he's recognizing here are that there are some pretty significant legal issues coming into play. So how can we help with legal issues arising from the pandemic? So we'll list that and make sure we respond to him as well with that. So that's a second piece. What other things are you seeing, hearing on the ground? What else would you like to share?
I don't have anything more. This is Dave Pazinski. I don't have anything more particular to share, but I was glad to see Nancy here. Thank you for coming to this, Nancy. And I don't want to put you on the spot, but in your role as the voice for so many different agencies and people, is there anything that's starting to surface that you would want us to know?
She'll have to unmute.
Nancy, it's Nancy Eaton. I'm not sure where she is. I know she's on here somewhere.
She's 315. She's one of the telephone numbers.
Nancy, any luck in being able to join us?
Maybe the chat box.
Which Nancy are you looking for? Nancy Eaton,
I was looking
right?
for Nancy Kearns Eaton here. I know she spoke, I thought she spoke earlier.
She did. There's a Nancy's iPad, and then there's a Nancy who's on the phone.
Yeah, I don't see her listed on the participants here, so I don't know what to make of that.
She was one of the call-in numbers. There was a third call-in phone. It's possible that was her and her call got dropped.
Yeah.
Oh, Dave, can you hear me?
Now we can hear you. We got you.
Oh, I'm sorry. I was trying to do the *6. So give me 1 second. I'm actually just leaving a meeting, and then I'll be able to, I wanted to hop in so I wouldn't miss you, but give me 1 second and I'll be able to weigh in a little
Sure.
more.
Thank you, Nancy.
Sorry for the noise.
No problem. Thank you.
So first, what I would love to say in response to the nurse is when this COVID crisis began, we worked with the county to set up a phone line so people who couldn't get out could call to let us know they needed food delivery. So the way I think I want to make sure everybody knows about 211, which is the 24-hour a day, 7-day a week phone line for people to call for information about services. Not that they can solve every problem, we know, but it is a great resource, 211.
Wonderful.
The other thing, you know, Dennis and all of our legal service agencies have done extraordinary work during this time. And the Housing and Homeless Coalition actually gave their annual report today to talk about what they expect will happen when the eviction moratorium is lifted. And it's a huge concern. The city and the county are allocating some of their emergency shelter grant money to help people with back rent. But, you know, we don't have any idea yet how high the need will be. So what I would say, you know, through the COVID Community Support Fund, we, working with the Community Foundation and the other foundations, we've distributed $1.8 million so far. And we've really spent the fund. So the question now becomes, you know, sort of how we are all going to work together to continue to respond to the community's needs. We know food is an issue, so we're trying to get a real sense of that. But this is, I mean, I wouldn't want to live anywhere else, for sure. But there are so many ways, as we all know, that this is affecting people.
Thank you.
So the 211 is a wonderful resource, and anything that we can do to help spread the word about 211, I think we all want to do that. We want to be able to do everything we can to help people out here. You guys, Nancy, if I understood you correctly, you guys have raised and distributed 1.8 million already?
Yes, and I have to say, the Central New York Community Foundation, all of the funders work together to put that fund, but the Community Foundation actually seeded the initial $300,000. And then a lot of our local corporations gave, individuals gave. And so we supported 121 different community grassroots efforts that were churches that distributed meals, virtual technology, so organizations could continue to connect with people who really needed services, a lot of food, and looking at, you know, system stuff to make sure people weren't getting lost. But that fund has pretty much been expended, and now we're trying to think about next steps and what are the issues that appear to be
Sure.
things that we're going to have to address. Certainly housing is a big one.
Nan, are there plans to begin raising additional funds?
Well, we're sort of looking at it to try to assess,
Okay.
the Food Bank of Central New York has done a fabulous job of accessing resources. The governor has made resources available. So we will keep people posted. We're really right now, and if anyone has any information, please share it with us. But, from my impression, and I know the county is tracking all of this, we're just trying to, as sort of a funding community, get a sense of what we think the needs are and what they're going to be, and then, sort of come up with a plan. So we'll keep everybody posted. What I will tell you, though, that a message I know all of us would like folks to hear, whatever you care most about, if people have the ability to make a contribution, please do that, because every nonprofit is struggling right now, as many of our community members are. So I really would encourage anybody who has a passion about a particular cause, support whatever you can, because so many of our, really incredible service organizations, groups are struggling.
Thank you. Part of what the purpose of tonight is to be able to do what we can to lock arms and help people. So thank you.
Absolutely.
Thank you. Thank you.
Well, and thank you for all you do.
We got more to do, that I know, and the more we can do together, all of us as a community, the better off we'll all be. So
You're singing
Thanks.
our song,
I just
Rabbi.
want to say thanks, Nancy, for not only your input, but for being a conduit, not only to the community, but to the community about this meeting as well. So thank you so much.
Oh, gosh. Yeah, we're honored to be part of this community. And we are the community, right? I mean, United Way is about the community.
Rosalie.
I'm concerned about the seniors, single people who are isolated. They're afraid to go out except for vital things. And they're getting depressed. Any suggestions?
So marshaling mental health resources for the community.
And
There's-
some kind of social interaction.
I know many of us are aware of services through Contact. I've been very involved there in the past, and a little bit during the earlier part of the pandemic. I went back on a job that I did 25 years ago, staffing the phones there a few times. Actually, the days I was there, I didn't have a particularly high number of calls related to COVID, but I know that others have reported that. So they have a way of reaching out to isolated individuals. They call them on a regular basis. They call about 75 people a day, I believe, to just touch base and make sure that they've either that they got up all right, took their meds, how they're feeling today. Brief conversations, which may or may not lead to a more extensive intervention. But Contact would be a good resource to talk to about how people can reach out there.
And you can reach them by calling 211.
That's right. They have a 211 line as well. It's quite a comprehensive way now that they deal with folks.
Nan,
Yeah, they do a great job.
Nan, one of the questions that was asked was if we can have information on where to donate money for housing relief. That would be useful. Do you have any suggestions on where people could make donations?
Well, certainly if people wanted to donate it to United Way of Central New York, we can segregate that money. And then as the community identifies ways to utilize those funds to specifically respond to the housing crisis, we will use those funds that way. So if people want to make a donation, or they can give us a call. You know, the Housing and Homeless Coalition staff are part of our staff. We're proud to have that be housed with us. So they're coordinating with the government folks all the time. You know, we have an amazing housing and homeless coalition for our 3-county region. And prior to COVID, we were one of the few communities that was actually decreasing homelessness. So they really, really are working on keeping track of what they think is going to happen. So what I would say is people are welcome to donate to United Way and let us know this is specifically for this emergency housing relief. Or we can just continue to share information with you and others as we really identify more ways that specific needs related to housing can be addressed.
Okay, so Dr. Levy.
Hi, thanks. Going back to the mental health question, I'm pretty sure the New York State Department of Health has a emotional support hotline. I think they're calling it New York Project Hope, that anyone can access if they need to speak with someone, a mental health professional, outside of whatever county resources there are as well.
Thank you. Leo, go ahead. Leo, you want to unmute yourself?
Oh, here I go. I just wanted to say another with the mental health issue, there's another resource called Psychological Healthcare. Dr. Levy, I don't know if you've heard of them, but they're taking on new patients, and they go anywhere from private insurance to HMOs and Medicaid, Fidelis, Molina, and things like that. And I know Dr. Fish and their staff, ACR Health, where I used to work, has worked with them extensively, and they are taking on new patients. And I know there's a contact is good. I used to work there as a short term, but this is good for long term because there's seasonal depression, and there's the depression that's been caused by the COVID. So if they want to have someone speak to them on a weekly basis, 45 minutes just to engage a person, they are fantastic. I've worked with them for over 5 years and referred many people. I mean, there's also Brownell, but there's a waiting list of almost a month or two. But I suggest psychological health care. That's just something I want to add to the mix.
And Sue Stanzik, forgive me for tripping. Sue Stanzik posted in the chat box Project Hope hotline and the number there. So for those who can't see it, 844-863-9314. Sue, thank you for sharing that. What else are you hearing in town and around as you're interacting with people? What sorts of things need to be brought to our attention, either as a commission or as a community? What areas seem to be most acute right now? Sue, go ahead. You have to unmute though.
Hang on.
So is the county ledge going to figure out a system of muting and unmuting the members after the pandemic's done, so they can just, the floor leaders can just?
She should be able to unmute.
There I am.
There you go.
I'm not sure about the county ledge. I'll have to check with them and see what they're going to do. Gotta love technology and the Zoom, as everybody else is frustrated with it as we are, I'm sure.
We all are. We all are.
So just I just wanted to add a couple things. First of all, thank you very much for putting this together. For those of you that don't know me, I am Sue Stanczyk, and I'm the Chief of Staff to the County Executive. And I just wanted to take a moment to thank you. And Leo, thank you for your service as a nurse. That's awesome. We really appreciate that. Everybody in the community has stepped up so much to help us out. And it's just amazing how well people have come together in this community and put barriers down and lended a helping hand. And it means so much to all of us here. One thing that we do desperately need, and if you can help spread the word, Leo, you made mention about the fact that the lines are so long at the testing sites. As you all know, we're testing as many people as we possibly can. We are paying for the testing since insurance has dropped asymptomatic testing and won't pay for it any longer. So the county has stepped up and we're trying to pay for it, because if you don't test, we don't know what's out there. So we're trying to do as much as we possibly can and to keep everybody safe. But one thing we really need, if any of you have contacts with anybody, we are trying to staff the on-center 7 days a week. We're staffing the school districts, everyone that's in the yellow zone right now, and also those that eventually will probably be put into a zone 2. And then we also have the FSHED, both asymptomatic and symptomatic testing going on. So we are in desperate need of licensed professionals, EMTs, RNs, LPNs, CNAs, anyone who carries a license. We are paying to have those people to volunteer. So if anybody knows of anybody, please, I will put my email address in the chat box. And if anybody can just pass that information along to me, they can fill out an application, a county application online, and send it to me, and we'll plug them in right away. And anyone willing to volunteer on data entry or just assisting, even sometimes we just need people to help with moving the lines along during the testing days. When we're using all of our county employees, Monica's office, Montanet, they've all stepped up and they're sending us people, and we're pulling people from every office in county government. I think we had our entire DOT before it started to snow. They were out data entry and doing whatever we tell them to do and helping out. And they've really been wonderful. And that says a lot to our community. So if anybody has any names or anything they want to share, we do need the help. We're doing as much as we can, but there comes a time where we have to plow the roads too. So we can't have all of our plow drivers in line right now helping. So we're trying to work that out. So that's really our biggest need at this point. And I appreciate the information. In the very beginning, we did a lot with food delivery services, and we're going to probably have to ramp that back up again. We think we got a really good system going. We were able to get over, I believe it was 700,000 meals we put out to people earlier this year. We'll continue to do everything that we can. United Way has been a wonderful partner with us, and several of the community factors or community groups have too. We've received a lot of donations. The food bank has been wonderful to work with. It's been really great. It's been it's a breath of fresh air to have all the municipalities working together. People put politics aside, which is what we needed to do to move forward. And so we do appreciate everybody assisting us. So thank you very much for that. And if I can help or answer any of the questions, I will try to. We are very aware of the eviction problems. And so we are on top of that. We're trying to do what we can to assist that. The moratorium is in effect until January 1st. We know it's going to be a problem after January 1st. And there is another side to it. There are the good landlords that unfortunately are running into the same issue where they're not receiving the money from people that can pay rent, that are choosing not the ones that can't. I'm talking about the ones that can, and they're not, and then realizing that after January 1st, they're still going to be responsible for that money. So there's got to be something, there's got to be a program that the state has to come that will benefit the tenants and hopefully give some benefit to the landlords that are deserving, obviously.
So on the question of needing people to volunteer or with medical abilities to be able to step in, two questions. One, how do we best broadcast that, and how is the county broadcasting those needs? So what can we do to help it, and what's the county currently doing?
So right now what we've done is we've reached out to any of the volunteer firefighters because they're probably the ones who have more of the flexibility.
Sure.
We've reached out to nursing schools, but again, a lot of the nursing community is already overwhelmed. So anyone that we've done law enforcement, we reached out through our emergency management office to any of the people that they have contacts with. We have it, I believe there is something on our website. The county executive has referred to it in any of the local community group meetings that we've had, and really tried to just do our local reach through our boards and our commissions and our other groups and see if any of our contract agencies has anybody that can help out. And I think we're reaching our maximum capacity with trying to get all those people to help out. So you guys are just another outlet. So hopefully you can spread the word too.
How do we, if we spread the word, who do you want them, who do you want us to have them contact?
They can contact me. They can
Okay.
contact me.
Okay, great. Thank you.
Thank you.
Leo.
I just want to know if Sue would leave her contact information, because I have a number of people that are willing to volunteer because they have nothing to do, and they are the ones that have no jobs right now because they were displaced. So if she can give me her contact information, I have almost a dozen people that are willing to help.
Leo, your wish is her command. She has already posted it in the chat box.
Thank you. That was it.
That's fast service. That's impressive. Those of you who haven't spoken, I want to give you a chance to speak and share any thoughts you have. So please let us know.
I think Suzette has a question.
Please.
Yeah, I wanted to say that with regard to the housing situation, that's something I want to emphasize. I'm really very concerned about it. I'm also troubled by the issues with regard to law enforcement, seeing this as not an area that they can actually contribute to. And I'm hoping that maybe, especially since we have representatives from the county executive's office, that we can utilize this coordinated approach to maybe talk to law enforcement and to remind them that, you know, the law is there for a reason. Due process needs to be afforded to these individuals that are in these dire situations. You know, I respect the fact that there's certainly good landlords out there, but, you know, Leo's talking about, you know, a dozen people that got laid off. I mean, it hasn't been easy for anyone, but we still have to make sure that the law is followed. So we can appeal, if the county executive's office can appeal to the leadership in law enforcement across the county to make sure that that's being done and talk about what they're seeing, that would be greatly appreciated. In addition, I'm also really troubled by the isolation that Rosalie spoke of by the elderly. We just set up Zoom capability for my mother-in-law, which talking through her through that was interesting, but definitely worthwhile. And I also wanted to raise the fact that for those people that can use it, there's an app, COVID Alert New York, that people can use to try to keep each other healthy. And it does have, from what I understand, privacy protocols in place. So you can access that and have it on your phone for those of us that have that. So maybe if that information can be disseminated, I think it would be good. I've installed it on my phone. And then finally, with regard to another isolation issue, I wanted to raise the fact, and this just, I think, is horribly unfortunate. I don't know if you all saw the article with regard to their house. And I think how that was, I'm going to refer to it as perhaps a misinterpretation of what the Vera House leadership was trying to do or is trying to do. But that is really not going to play out well for victims of domestic violence that already are isolated by this pandemic. And, you know, the impact that that could possibly have on that population, I'm really concerned about. This is my wheelhouse that I'm talking about now. So I'm really concerned that that was taken as a personal assault. I don't think that this is personal. It is community-wide, it is systemic, and we have to be able to have these conversations about how we can do this work better. And without then having the consequence be that people who are victims of domestic violence are now more vulnerable because people have decided to leave their seat at the table. So I just, if there's anything, any coordination that the county executive's office can have to try to bring those people back to the table, understanding what this means for the community that Vera House serves, I would, you know, respectfully request that you do that on behalf of individuals that are going to be impacted. And that's not to say that, you know, the things that were raised are not an issue. We're dealing with issues that have been raised by Black Lives Matter across our country, our state, our community. But I just don't think this is the answer. It leaves vulnerable the very people that we're trying to serve collectively.
Thank you. I want to welcome Mr. Bonibus, who joined us. And Antoinette just posted the website for the COVID testing. So that's in the chat box as well. And Kathy, now we can see you. It's nice to see you. Who else would like to add? We'd love to hear from all of you.
Anyone?
And Sue Stanzik just posted the COVID alert app that's available. So that if you would like to add that app and download it, you can. It's a cool little bit of technology that hopefully will soon find itself obsolete. But for the time being, it's a really cool thing. Anyone else have any comments to share?
Rabbi, this is Nancy Eaton. I just wanted to add one other thing. First of all, I was glad to hear that Sue was part of the conversation. I have said it many times, and I would love this opportunity to say it again. I think that our county leadership has been extraordinary during this time. And we certainly are fortunate to live in a community where people really do work together in this way. I also want to salute all of you for putting together this conversation tonight, because it's always good to be able to share information. And, again, we're happy to help in any ways we can. And I appreciate people letting us know what they're hearing, so we can continue to try to help connect people as best we can.
I agree with you. I think, to me, the county response has been a wonderfully non-political response. It has been a human response. And I'm really thrilled that that's been the case. Too easily, this whole thing has become politicized in 1,000 different directions. And at its heart, in my mind anyway, this is a human issue. And so when we can come together as humans, as people, and be able to listen to each other and hear each other, I think we work ourselves out of the problem and towards success. So I agree in applauding the county and being able to work together. And we hope that this hearing is just the beginning, that we can sort of expand and build connections between us so that we can do more.
I think it's a wonderful idea. And, I think if we look back to literally when County Executive McMahon took office, one of the first things he did was he said, we have issues around poverty. We have issues around a lack of diversity in so many ways. I really think that it has helped us go in better directions in a lot of ways. And I agree with your optimism in terms of continuing the work we're all doing together. I will tell you that the funding community is working together as never before.
Good.
Which helps everyone. And I just can't say enough about the county executive, Ann Rooney and the team, Dr. Gupta. Honestly, it's just been, I met so many people at the county during this pandemic I had never met before. And it was sort of like the daily calls to think about adult feeding, and then how are we dealing with the city school kids, and what about the suburban kids? And it's been a privilege. And also just, I'm not from Central New York, so it's again reminded me why I love it here and how much I appreciate this incredible community.
So on the notion of the city kids and the suburban kids, one of the challenges that we found in organizing this hearing this evening actually was that we know that there are people out there who have needs who don't have the ability to connect into a Zoom. And so the question is, how can we help them? And we knew we would have a hard time even getting them connected to this Zoom, much less to the Zooms they need for their school, their jobs, whatever it is. That's a piece that as a community we've got to figure out how to help people in need. And again, on a human level, I think. To me, that also isn't a political piece. That's how do we help people remain connected and able to do what they need to do on a communal level. So I don't know if people have thoughts on that idea or that subject, but we'd love to hear them. We want to emerge from this as whole a community as possible. And we know that that's a problem. The question is, how do we come together to solve it? What can we do? Suzette.
Sorry to speak again, but this has been an issue that I've sort of been, again, really concerned about and harping on is the digital divide. And the place that, it's a lot of different places. I'm concerned about the community that has no internet service, especially those that live alone or have poor internet service. I am particularly concerned with our children, particularly those that come from poorer neighborhoods that maybe don't have the ability to have good internet service like I have right now, and what that is going to mean for their education long term. And I know that we are facing this issue on the Hill, at FU, at the law school, with regard to our students who are differently situated, financially. I'm really concerned about what this means for the kids, particularly in inner cities. And I'm also wondering, given the fact that I think this is going to have long-term effects, how do we help them not only now in the moment, but how do we help them make that time up, make that lost instruction up? Like, are there resources that we can compile as a county to make available to them where they are, either through community centers or through the schools, talking to teachers, that kind of thing. And I'm doing I'm facilitating a community book read group right now through Onondaga County Bar Association, and the book is Just Mercy. I've got lots of teachers and other people that are working in the Syracuse City School District that are coming into that group. And these are individuals that, really care about the kids that they're servicing. So I'm glad you brought that up, Rabbi. And I would say that we need to keep thinking about how to serve them now, but also in the future to make up the time that they've lost.
Sure. Sue.
I just wanted to add on that. We actually, back when the pandemic started, actually prior to the pandemic, we had, we invested in tech packs that we distributed at the local branch libraries to help students and to get them the broadband access that they needed and to give them the equipment to be able to do the work. Once the schools closed, we gave out an additional 200 of them, and we're working on supplying more. So that is one thing that we have funded and we will continue to fund. We know it's an issue, and we want to make sure that, every child's given the opportunity to learn. So we are working on getting more. The budget has been obviously a little tight this year, but we have prioritized, and that is, and again, in line with the county executive's PIE initiative, poverty being one, and that's the first step. And we do know that the way out of poverty is we need to get people to stop the systemic poverty and to move out of it. And the only way we're going to do that is through education. So we are very well aware, and we are trying to get more, but we did give out an additional 200 early on, and more than likely we'll have to do many more than that coming up in the future. But thank you for mentioning that, and we will continue to focus on that.
Great. Leo.
Sue, on that note, I want to piggyback on what you said, which is that I spoke to a lot of parents, mainstream students that are, your average students are doing well, more or less. But then I have parents that talk to me and friends that have children that have learning disabilities, autistic, ADHD, behavioral issues. They were thriving before because they had face-to-face education, and now that they're doing virtual education, their grades have gone from B+ and A's to F's, and they're not addressing, there's not enough people in the educational community to help the students that have behavioral or mental health issues or what have you. So how do we help those parents make those kids not feel so isolated and feel not so disconnected, as it were?
I wish I had an easy answer for you. It's a struggle, and I get it. My son has terrible learning disability, and if he was still in school, I honestly don't know how we would be able to do it. I mean, it's very difficult. You have parents that have to work, and you have parents that are trying to split their time. Mainly, that's the main reason why we're trying so hard to get testing and be able to get people back in school 5 days a week, especially those that they really need it. And, we talked earlier about the isolation of seniors and the depression that's going hand in hand with that. You're going to end up with the same thing with our youth. They need that. They need that consistency and they need that daily interaction. So it is a struggle, and it's one we're aware of. Our hands are tied a little bit by the state education department on what we can push for. I don't want to make it sound like we're not pushing. We push every day to try and get to the next level and to make these things happen. But honestly, I don't have an answer for you. I'm sorry. I wish I did. But we take our, we take what we can and we try and get a little bit more than what we're allowed to do. I'm hopeful that it's a focus moving forward. If the schools are not going to be back in session, there's got to be a better answer. And the better answer unfortunately, isn't Zoom.
I have a question. I want us to, to me, I feel like we've gotten a little off track. I'm sorry. I know that COVID-19 testing is important, and I want to know if we can get back to focusing on the hearing. I feel like we've sort of taken a couple of rabbit trails, and so if we can get back on our path of the COVID-19 hearing.
Sure. Suzette?
So I'm a little bit confused because I thought we were talking about basically the consequences, the issues that people are suffering as a result of COVID.
So then I think what we need to do is refer to some of the emails that we may have received at the Gmail account. And also, if we could let some of the community members speak, that would be ideal. We are trying to get information from the community to see how COVID-19 has impacted them. And so I don't want this to turn into like a Q&A for Ms. Stanzik, but more along the lines of want to hear from the community. That being said, we have a couple of community members, and I would open the floor to them, please. Anyone from the community? And then
Kathy, go ahead.
Hello, my name is Kathleen Kogel. I'm a lifelong resident of Syracuse. I'm a graduate of Syracuse University. And in my travels as a community member in Syracuse in particular, as far as now that we're into, what are we into now? Month 8, I would say, or the 9th month of the COVID impact on our community. What I'm hearing from the people that I'm in contact with is there's quite a bit of confusion and kind of like a sense of overwhelm as far as where can people get tested. There's a lot of misunderstanding. I won't say that it's miscommunication, but I think that the information coming out from the media is maybe a little unclear. I was at a meeting the other night where people were saying, I really just I don't know, am I supposed to go to the F lot? Am I supposed to go to the on center? What are my opportunities here? What are my options? And I feel that to have some kind of maybe a more frequent, maybe something more something shorter and more direct and more frequent about giving out that public information as to, as more opportunities for testing and more sites are opening up, to make sure that is getting exactly to the people that we all here have been talking about, the people who do not have daily, all day long access to what most of us here have. Perhaps, I don't know how this would work, perhaps more public service announcements just on the standard cable, the standard cable providers. I don't really know how much of the populations of people that we're talking about here, how much time they spend on social media. So I'm thinking about this in terms of public communication and dissemination of information, because I can tell you that it's getting confusing, overwhelming, and a feeling of I might as well not even try, that it's becoming a barrier. In addition to all of the other barriers, there's transportation, there's, do I really need to be tested or not? And where on earth would I go? How do I get there? For example, I met a man and his wife and their children, and over last week, one by one, each member of the family began to show symptoms of some kind of flu virus. Although they did go to the community health center for testing, there was an app that was involved, and he happens to be someone who is familiar with smartphone technology. But there's enough people in the age groups and the populations that I'm hearing you all discuss here that really just don't have, as I think Selena it was who said, the digital divide. So this is a very real thing. So I would offer that trying to get that critical information out in every way that's possible is probably crucial right now in terms of just focusing on testing. I know that the health department needs to gather data now. I know that that's the most important thing. So if I think of anything else, I'll speak up again, but that was my thought at the first thought in my mind listening to you today.
Thank you. Thank you for sharing.
Sure.
Any other comments, questions, concerns? Barnabas.
That's good. Good. Go ahead and unmute.
It's good. Yes, thank you. My concern is that the COVID has impacted mostly the communities, especially the Congolese community. Most of them, they don't speak English, and they are lacking the information on COVID-19. And for the first week when they wanted, for the first week of, especially one of them is on education, on the side of education, where they don't know how to use the computers that was given to their kids. They don't know when the assignments were assigned to them, because first of all, they lacking knowledge of technology. So especially the kids from all levels, especially from kindergarten, they they are like sitting home. They don't know how they are being taught. Is a home because the parent doesn't know how to use the computer. So if the kid doesn't know how to use the computer, then that kid will not be learning anything. The other thing is that the testing. They don't think that house testing is very important because they won't get treatment once they test positive. So they kind of neglecting testing because there's no medicine or there is no medicine for if they test positive, you won't be admitted or how you can go about it once you test positive for the COVID. So I don't know. My suggestion was that maybe is there any way? Is it okay or possible to create like a center in Northside where all kids from all levels of education or all levels of classes they attend to maybe to see how these kids be helped because they are not being helped at all at home because the parents are lacking the technology knowledge and also they don't know how to communicate with the teachers or know how to go with their schoolwork. So all this has impacted I can say probably like the refugee side or the new Americans. So I don't know how that can be solved or be handled. But that's all. That's all I had. Thank you.
Maybe that's something we can have a conversation with the Syracuse City School District, reach out to them and have a dialogue about how to address that particular issue.
Yeah, for sure. What other comments, thoughts people would like to share? I know the hour is running late and I appreciate everybody's attending here, but I want to make sure everybody has a chance to share their thoughts and their words. So.
And were there any emails? Did we get any emails or any comments from the Gmail account?
I haven't seen, the only one I got was the one that I mentioned earlier. So I haven't seen if there have been others.
So we're coming up on the hour of 7 o'clock. John Rushing.
Hi, everybody. John Rushing. I just want to start off by thanking everybody for participating in this conference. I was hoping that we had a lot more other community members involved in this because I'm a little remiss because I felt like there could have been opportunities for other communities to assist others where they're expressing deprivation in certain aspects of their livelihood due to the COVID. But as a person who works in the public and deals with the public, I would just make an acknowledgement about some of the things that I see going on that I find concerning. A lot of people still come in to the place where I work, sometimes not wearing a mask. Some people are emboldened in not wearing it. Others do express apology about not wearing one when they come in, and we do offer one for those who do not have it. But to me, more so now, this is just an opportunity to express the new normal, is what everybody likes to say. So like what I've been encouraging people to get in the habit of doing is like, you want to go, when you're going somewhere and you're going in your car, you have a mask with you. And you keep that with you like you keep any other regular part of your life with you. You keep a mask. That is paramount to us fighting this pandemic. It's been proven time and time again by scientists and doctors. And I think it's time that we listen to the knowledge that we have accumulated in all these times. This is the one time that us coming together really is life or death. So that's my comment in regards to that, you know, wearing a mask, reducing, you know, the number of gatherings or how big a gathering is, staying in your particular bubble, your quarantine bubble, and social distancing. You know, just little tidbits. I think that if we help remind each other of, that is just one more extra punch in the fight that we can contribute to help our society. Thank you.
Thank you. We also received a letter from Onondaga Community College talking about their response and how they've handled all of these challenges. So we'll put that into the record as well, along with the comments from Dennis that we mentioned earlier.
Okay. Are there any more questions or comments? Okay.
Leo, you got the last word, it looks like.
It looks like Kathy had her hand raised
Okay,
as
Kathy
well.
too. Kathy, go ahead.
She should be able to go ahead.
Okay,
There you
just very quickly, this is a very kind of a very obvious comment. Very sadly, I think that many of the issues that we're talking about here today would, in an ordinary time, would be best handled by the professionals in the library systems, in the county library systems. The library has always provided places for people to be, people to be together, maybe not socializing, but at least to be together. And unfortunately, I'm just making an, this isn't really a very helpful statement. I'm just expressing the frustration of, not having access to our wonderful county library system, the city branches, where so much of the third space happens, where so much of the external education, adult education, people being given access, being given one-on-one instruction, how to use the technology, access to the technology, and all of that's been cut off now. I don't know that there is much remedy for that, but I guess I'm really hoping that somehow the people who are making the decisions for the county library system can continue and be encouraged to continue to find a way to make all of the ways that the libraries, all the things that the libraries provide to the community, to reach out and make those things available again to these exact populations that we're talking about here today. That would be my hope.
Thank you.
Thank you, Kathy. So
Leo.
Rabbi, you want to put into the record the OCC letter, or you just wanted to make mention that we did receive a letter from OCC?
I mean, I'd like to have their words in the record, and I can forward the email to you if you'd like.
Excellent.
And I'll forward the one from Legal Services as well. I mean, there's no reason not to include those. We'd like to. It seems to me that the more full the record can be, the better. So.
Okay. If there are no further questions.
Leo was about to ask or say something.
Sorry.
So Leo,
thank you.
As a final note, I wanted to say thank you, everyone. I'm so happy. And I wanted to hear from the diversity leader, Miss Monica. Did you want to have a final word at the end of the evening for us all as a word of support and compassion, and just tell us what your feelings are, because I want to hear from you.
Good evening, everyone. Can you hear me? I think I'm unmuted. Hi. So first of all, thank you all for joining in and having this public hearing. I think it's needed. I think there's a lot that is going on in our community in regards to COVID-19. I think people are overwhelmed. I think, there was a lot of great points made tonight. I think that we do need to have those relationships to help one another get through this. But most importantly, if we all can take back and pass along the importance of continuing to wear our mask and to continuing to social distance. And, it is important that people understand that what we have all been used to, I want to say 2019, when we would get a sniffle, we would think it was, oh, it's just a cold, oh, it's just my allergies. I can't stress enough that when people feel that way, it is very important that we begin to tell them that, we need to get tested. We have to be safe for our neighbors, our co-workers, and for everyone that lives and make up our community. If we all do our part, this hopefully will go away sooner than later. But I want to thank you all, and let's just keep encouraging the community, to social distance and to wear those masks, and and that's the biggest thing. And I know we still have people out there that are very skeptical, that say that this is just, I've heard people say, oh, this is just a farce, this is not true, and for those people, you just tell them, I value you. I want to make sure that you are here in our community with us. So I am going to continue to wear my mask and social distance for you. It is not about just wearing it for me. It's about wearing it for you, for me to protect you. And I think, I'm starting to see a lot of people wearing their masks and social distancing, but I think we just got to keep saying it. And I know it's overwhelming, and I know people are tired. We're not used to this. We're not used to not being personal, not being able to touch people and hug and all of the things that we find to be normal. But if we all do our part, we will get back to normal at some point. So thank you all. I really appreciate this. This has been enlightening. And thank you.
Thank you. Thank you all for being here. Please stay healthy, stay safe. And this will conclude our public hearing. Thank you all for joining us.